So now we'll discuss the female sexual response. The neurological and the vascular controls of female sexual response are essentially the same as the male. So the emphasis here is on ways that the female response differs from that of the male. We have the same four phases: excitement, plateau, orgasm, and resolution. We'll look at these in detail. In the excitement and plateau phases, we see the labia minora becoming congested. They often protrude beyond the labia majora. The labia majora also become reddened and enlarge. They flatten and spread away from the vaginal orifice. The vaginal wall becomes purple due to hyperemia, and serous fluid called vaginal transudate seeps through the wall into the canal. Along with the secretions of the greater vestibular glands, this moistens the vestibule and provides lubrication. The lower 1/3 of the vagina constricts to form a narrow passage called the orgasmic platform. The narrow canal and the vaginal rugae enhance stimulation and help induce orgasm in both partners. Now, the uterus normally tilts forward over the bladder. During excitement and plateau, it extends nearly vertically, and the cervix withdraws from the vagina. And the whole thing extends up into the false pelvis. This is called the tenting effect. Now, the vagina is the female copulatory organ. However, the clitoris is much more comparable to the penis in structure and physiology, and has importance as the primary focus of erotic stimulation. So thrusting of the penis tugs on the labia minora and thus pull on the prepuce, which stimulates the clitoris. The clitoris may also be stimulated by pressure between the pubic symphyses of the partners. Breasts also become congested and swell, and the nipples become erect. Late in the plateau phase, many women experience involuntary pelvis thrusts, which are followed by 1 to 2 seconds of suspensions or stillness. These precede orgasm. Orgasm is an intense sensation spreading from the clitoris through the pelvis, sometimes with pelvic throbbing and a spreading of a sense of warmth. The pelvic platform gives 3 to 5 strong contractions of about 0.8 seconds apart. The cervix plunges spasmodically into the vagina and the pool of semen. The uterus exhibits peristaltic contraction, which acts to transport semen up through the cervix. The anal and urethral sphincters also constrict. And the paraurethral glands, which were homologous to the prostate, sometimes expel copious fluid similar to prostatic fluid, which is how we might see the female ejaculation. We also see tachycardia and hyperventilation, just as we did in males. And sometimes women experience a reddish, rash-like flush that appears in the lower abdomen, chest, neck, and face. During resolution, the uterus drops back down and forward into its resting position. The orgasmic platform quickly relaxes. The rest of the vagina returns more slowly to its normal dimensions. The flush disappears quite quickly. The areola and nipples undergo rapid detumescence. It may take about 5 or 10 minutes for breasts to return to their normal size. In many women and men, there's a post-orgasmic outbreak of perspiration. Unlike men, women do not have a refractory period and may quickly experience additional orgasm. So that concludes our section on the female sexual response. We'll move next into pregnancy and childbirth.